I worked for Dr. Gleave for about 3.5 years.
Yeah.
And I was his office manager and just saw all the wonderful work he did. He wanted to do my teeth. I've never had a cavity in my life. And so but I was grinding them. And he wanted to do them to make me look beautiful, and I just didn't want to look beautiful, I guess. So I just, at that point, I just never had any work done, and so I just didn't. And then I've been gone for almost 9 years.
Yeah, a long time.
And about the first of this year, I just decided I wanted him to make me look beautiful, and so he did.
One of the things that made Linda's case more complex was the wear she had, which she didn't like. Her teeth had shortened. So that obviously ages someone more than they should, especially with Linda. She's a very attractive woman. And the other part of it that she didn't like, and I didn't like either, is she showed too much gum tissue. So we had to do a combination of treatments. One was to address the gum tissue, because the gums then become the framework for the smile. So we use the laser to recontour the gum tissue and remove some of the excess gum. Then we could go in and place the veneers and recapture some of her youth before she had worn those teeth.
The gums.
And now I think when you see her smile, it looks beautiful. The shade is very appropriate for her complexion. It's a very nice white smile, but not excessively white. It looks very natural to me. It's framed well with her lips, and I think the result is just what I wanted, and I know you're happy with it.
I didn't want to go the Hollywood bright, because I wanted it to age with me as well, instead of, when I'm a little older. I just didn't want it to look fake.
But this still is a really nice shade, and it's lighter.
Natural.
It's lighter than your natural teeth were, and you had pretty nice teeth. So, definitely I think we've enhanced that smile and helped you, not feel embarrassed or bad about the way you
they were just wearing down. He does, as far as the work, when I came in to have the work done, he's very professional. He knows exactly what I wanted, the look that I wanted. I explained, but he took the ball, and then even when he had sent the molds off to the lab, he wasn't really happy, he thought about it overnight, and he called the lab and wanted to change it a little bit, and I'm glad he did, and it was like a millimeter, but, to him that's a lot. He's not one that just went to dental school and then just decided to have a practice and that was it. He is up on all the technology. He takes classes. He goes to workshops. He keeps up with all of the current procedures and equipment. Very educated. I just like it better. I just like my smile better. I just feel like I feel like I don't have to, I really never worried about it.
No, but I'll tell you one thing I really noticed, and you've probably noticed this too, it definitely has made you look younger. You're very attractive and you look young. This even complements that even more. For me, I really see that in your face. Before with the other smile, you had the wear, which I know you didn't like. You had the extra gum, and it just didn't match your personality. It just didn't.
Right.
And I for one see that this does match you for sure.
Absolutely. It's with the other ones that were grinding down, I would see pictures of me and think, oh my goodness, I look like I've aged 20 years, and this is really, I think, giving me a facelift.